This is a quick video on how to use the tools we recommend for measuring continuity of care. If anyone's uncertain quite where they're up to with continuity of care, please do feel free to use the Primary Care One website. This won't be searchable in Google, so you'll need to either copy the web address from here, or there's lots of links and various emails that have gone out to Primary Care One, NHS Wales Tools, GMS Quality Improvement 2025-2026. There's lots of useful webinars, and I would have a look at those. There's all the guidance documents. There's the poster that we're going to have to fill this year. It's a modified poster because we're not expected to manage to do this. It's a 5-year project. We're hoping to get to 3A, which is this step here, where we understand our level and have a way of measuring it. And hopefully people have been discussing this in their practice and looking at various issues they want to look at. Now, there is the usual GP tool that the RCGP tool recommends. I think this usual GP tool is very, very good. I was very impressed with it. It offers a very complex view of your continuity, and I'd suggest having a look if people have got an interest in these things. But the slightly simpler tool that we would like to use is the Bristol Continuity of Care. Now, this is a tool that's been created by Prof Salisbury in Bristol, and there's Dr Molly Deneen helping to run the project. And make sure you have a look at the videos here. The link to this, bristolac.uk, Primary Healthcare Resources Continuity Audit, and we'll share the link, and you need to register to download. You'll have to register to download and agree to the terms and conditions. It's not mandatory to share the information with Bristol, but we encourage it. We're happy for people to do that. We're looking at ways that we perhaps share this information with Bristol University and the team here from the whole national project. When you do fill that link, you'll get an email that looks a little bit like this, and they'll have a zip file, and if you open that up, it'll download that file to your computer, and then when you open that file, I would extract these files to make them easy to work with. So you extract the files, extract all, and you could either leave them in the download folder, or I'm going to create a folder on my desktop so I know where it is. And I should say, hang on, create a new folder, and I'm going to call it continuity. Now, there is a very good PDF summary and support here. So this user guide is definitely worth a look. It goes through all the steps I'm going to show you here. I think it's very good, very comprehensive. You will now need to go into your EMIS and import the searches they've given us. And for this next step, you need to be in the Population Reporting tab. So you open the EMIS ball, and it's under Reporting and Population Reporting. Many practice managers will be familiar, but I'm conscious lots of people are new to EMIS. And I would create a new folder here, so add a folder called Continuity. And when we've got that folder, you'll then want to click on that folder and click up here. If you go to the top left, there's the Import button. You click Import, and we're going to try and find that sort of search that the Bristol team have made and sent us in that zip file. And so we need to go to the desktop here and click that folder Continuity where I saved it, and you can see Continuity Search. And you run this up, and it'll be on the system here. Now, there's a useful thing to know. Whenever you click Run, you can simply run it with today's date. There is an option to change the relative date that you run the search. So you might decide you want to change this to the 1st of April, or run a series of monthly searches if you wanted to backdate, but you can run relative search dates. And we are going to run the search as of today. This is a quarterly population, and it's consultation types. It's not slot types it's looking for, and it's your GP consultations. So it's your home visits, your telephone calls, your face-to-faces, your video calls. It won't include some of the administrative consultations. Now, when we are exporting this data, what's important is you don't click the export results. So if you were reading their guide, they'd make sure you sort of knew this. You click View Results, and then at this point we say Export here. So we click Export, and we leave it as Excel. It asks us to exclude report headers and replicate details for each item. And you click OK. And again, it's all in this PDF. And we'll do that, and we'll save that to that continuity folder. and that's all in there. Now I can close my EMIS now, and forgive my messy desktop. I'll open up the continuity folder where we saved these things, and you can see that now there's the file that we've just exported from EMIS here, the continuity audit. So we're going to open these two Excel files. I'll open the continuity calculator first. It may take a minute or two to load up. When you do load it up, it's worth being aware. You will need to say enable editing. Again, this is the PDF. And they suggest turning off the autosave. And you can save it separately, so you can save the date or whenever you do it. But it's if I open up the continuity calculator, I'm going to turn off the autosave. Now this is when we need to also open the other Excel file. So I'll go back to my continuity folder from the desktop, and I'm going to open up the continuity audit, which is my practice data. And it tells you how to do this as well. So you click on A1, it's this top button here, and you click Control, Shift and End all at the same time, and it'll select the whole lot. And then Control and C to copy it. And you can close that down now if you want to, but you just leave it open. And go back to the continuity calculator. And this is where we then go to the Input tab. And you click on here and then click Control V to paste that data in. And that's our data in the tool. It takes a minute or two to load this up. Now we go to the results page, and initially you won't see anything in the results page because you do need to refresh all, and fair play to them, they've constantly put little reminders, so you need to go to the data menu at the top and click refresh. So you go to data and click refresh, and it gives me my various scores for my population for the last 2 years with descriptions. So I would consider looking at Prof. Chris Salisbury's video because he explains what the various scores are. What we like about this one is the modified SLIC, because one of the things that we can do is we can look at SLIC and modified SLIC based on the recent month. And so if we click that and then refresh, it tells you what your modified SLIC score was for the past month. And this is the thing that allows you to measure month by month whether or not your continuity of care is improving as you go, because this tells you of your patients in the last month, how many of them saw the GP they usually see most. So for me, my modified SLIC in the last month was 0.51 or 50%, which means 50% of the patients saw the GP they've usually seen most in the past 2 years, which implies reasonably good continuity for us. We're a small practice with a few number of partners. Now, this runs on a sample of your whole population. So it's not any particular population type, so it's not the frail, it's not the elderly or mental health. You can look to see how it compares with frequent attenders. So again, we could click that and click refresh. And that's an interesting one as well. You can see how often the frequent attenders seeing the GP they usually see. And for my score stayed at 0.51%, which again is reasonably good. But for the purposes of reporting and measuring this QI project, we're likely to want to use the modified SLIC based on the recent month. And we're looking at ways to import that or to input that data into your primary care information portal so that you can plot month by month how your continuity of care is doing. And you then, if it's in the portal, we can compare it across clusters or collaboratives, and we can compare it across health boards or nationally. Now, you can, if you want, you don't need to do this, you can also look at particular subsets. So it's important to note that we would be wanting these scores for your whole population. But if you wanted to look at continuity in a certain section of your population, you could do something with these searches. And this is where I would simply consider copying and pasting this search and have an extra copy of the search. And then we might create a new search that looked, for example, at all my diabetic patients. So I like using a search where I might say I want my diabetic patients, and I would look at my currently registered regular patients. And at this search, I like using the thing use existing search as results. And this is where you can go into your diabetic folders. If you have a folder of diabetic patients, which I do, I'll find those here. So if you have downloaded the QI searches as part of the diabetic searches, there is a diabetes register. So I might say, okay, I want my diabetic patients. And then you can change the properties of this search and ask it to run on your diabetic patients. And then what that would do is I run the same search, and you go through the same process there as we did before, where you export that file and you can feed it into the continuity calculator to give you a continuity score on that subsection of your population. You don't need to do that, but it may be something that practice would be interested in looking at.